Hi, I'm Maria. I'm a nurse injector at Cross Medical Group, and I've been working in plastic surgery for 18 years. The use of neurotoxins and fillers, when done correctly, have the potential to lift the face. These agents will give you a softer, more youthful appearance. Tonight, I want to take you through the consultation process of a mother and daughter and view the results. Hi, Beth. What brings you here today? I'm Maria.
Nice to meet you. I'm here because I want to look about 20 years younger. I'm 70 years old. I will be 71 in December. And what don't I like is the hollowness around my eyes. My nose looks wider and droopier.
Okay.
My chin, my jowls, my mouth all of a sudden is hanging down. So basically, my entire face, other than I think I mentioned my forehead, I don't worry about as much because I do wear bangs, but the rest of my entire face.
Okay. So as we age, we lose bone in the skeleton, in the face, the bones of the face. Okay. So what happens is, as we lose bone, then we lose volume, and the face kind of like falls inward. Okay. Plus, we get some loss of elasticity, and that kind of falls. So it almost makes your nose feel like it's bigger, but it's not. It's because you've lost volume and maybe some bone. So I think that we can do a few things for you with filler that may help to lift your cheek a little bit, put some volume here in your temples to pick that up, and to alleviate this pull down that you feel. We can certainly put some volume in your chin here. The mandible recesses as we lose again some bone in our skeletal and the skeletal tissue, and so we could pull that out. Okay, which may help with the downturned mouth. We did a little bit of Botox in her corrugators in her glabella area, which is between the brows, in order to lift her, to make her look a little bit more awake. Her eyes are a little bit more open, so she looks more alert in the second picture. We didn't do a lot on her forehead, and as you can see, the lines between her brows are a little softer. Now, obviously, it's going to take more treatments to retrain that muscle, not to do it. And this is her first time in probably a really long time that she's ever had Botox. We also did a little bit of Botox around in her crow's feet, which helped to lift her lateral tail a little bit so that she doesn't look as droopy on the lateral ends of her eyes, and that she doesn't look sad. So when the line is there at rest, it'll make it softer, but it's not going to take it away. That's why we all want to do Botox before our lines become stationary. Then it's more difficult to get rid of them. So we treated her temples, which helped to rejuvenate her eye and lessen her crow's feet, and also to pick up her cheek and her anatomy a little bit. And then we can move to the lower part of her face. We did some neurotoxin in her chin. As you can see, she has a lot of puckering in her chin. She doesn't look quite so smooth. So when we had her contract the chin, it was very crinkly, and she had that orange peel look. So we did some Botox in her chin, and the result is she's smoother, and the chin isn't as puckery looking, and it's just a softer look. I help you today with what you want to have done. I want you to tell me your age.
48.
Okay, I want you to tell me what you've had done, what you want done, and what you don't like.
Okay. So in the past, I've had Botox one other time, but one thing I really dislike is this, whatever you call that, and then that. Those are like my top two things.
Okay.
And then everything else. You know, just like the crow's feet, the wrinkle right here. This is really magnified here.
Okay, so have you ever had filler?
No.
Okay, and you're just basically interested in Botox?
Yeah.
Okay, all right. Okay, so we can do that. When was the last time that you had it?
It's well over a year ago.
Okay.
Yeah.
Okay. So we could do a little bit in your forehead. You have a small forehead, so we won't want to do too much. This muscle, actually, when you activate it, what happens? Look in the mirror.
Yeah,
When you raise your brow. Okay, what happens to the eyes?
makes it more accentuated.
They go up.
Yeah.
Okay, if you put too much Botox here, you're gonna come down like a curtain. So
Okay.
we're not gonna do that. So I want you to frown here like you're angry. Okay, so this is your corrugator. It's a muscle that is a medial brow depressor. It makes us look angry and it pulls the medial brow in, makes the number 11 or the number 1.
Right.
Okay, so we relax this muscle with Botox and the brow will lift and lift, lift and lift.
Wow.
So it'll make your eyes open more. Some of this will soften some of the forehead just because. And then we'll do a little over here so that this brow doesn't go wonky on us.
Right.
Okay, and a little bit here so you don't get that Jack Nicholson brow. No one wants that quizzical brow.
Right.
Okay, so that's Botox for the forehead. So it would be 1, 2, 3. This brow's a little lower than this one. A little bit more here to see if we can make you a little bit more even. And a little on the side and on the side here. Not much up here because your brow, activate that again. Your muscle actually stops here.
Right.
So you don't really have a lot of movement up there, so we let that go.
Okay.
Okay, then we're going to proceed to the eye, and we're going to do the muscles that make the crow's feet. We're going to stay lateral because you have a little bit of puffiness here, so we don't want to go too far.
Okay.
And that'll soften your eye. So you'll have this, this, and that.
Right.
Okay?
Yeah.
So then we go down to your lips. You could do a little Botox in your upper lip, but you may not like the sensation. So usually we'll address the upper lip with some filler, either in the lip. Let's see, contract that for me.
Like that?
Yeah, you don't really have too much, but we can put a little filler in that. Get rid of that. And then contract your chin for me,
I don't know if that's how you do it. Yeah?
like this. Yeah, that's it. That's orange peel chin. They call that peau de l'orange. We can put a little Botox in there, relax, and it'll soften.
Wow.
When you contract this muscle when you're talking, you're not cognizant of it. But people are cognizant of it, and you want to make
Right.
everyone look up here
Right.
and not focus on the lower part of your face.
Okay.
So by doing Botox here, it softens the muscle. When you talk, you don't get that contraction,
Right.
and everybody stays up here.
Nice.
Okay?
Yeah.
Now we're going to review Amy's results, who is Beth's daughter. Okay, so we did some Botox on her. So she was asymmetric before. She's a little asymmetric after, but she's smoother in the forehead, smoother in the glabella. Her eyes are more wide open. She looks more alert and awake. So doing her crow's feet helped to take off some of the push from her eye to not look so deep and pull down. The little line that she was concerned with above her left eyebrow, we were able to soften and not drop her brow. So she was very happy about that. So we also did her chin. So she has a little bit of puckering on the before picture and she's softer. And her lips look better because we did a little bit of filler in her white roll, which is the white vermilion, to give her structure and more support to her lips.